If you've ever been diagnosed with osteopenia or osteoporosis, or you have a tendency to break bones, or your children have a tendency to break bones, I highly recommend watching this full interview. Hey guys, my name is Judy Cho, and I'm board certified in holistic nutrition. And I have a private functional medicine practice where we focus on root cause healing, and it often starts with the Carnivore Cures all meat elimination diet. Today, I have the pleasure of interviewing Dr. Belinda Beck. She knows everything about bone health and has a bone clinic in Australia where she helps people strengthen their bones and try to reverse osteopenia back to being in a normal range for bone health. We talk through all the reasons why our bone health is affected, what affects bone density, how to test it, and how to improve your bone health. In this conversation, we talk about all those nuances. And more importantly, we talk about what we can do to strengthen our bones. One disclaimer I want to bring up in this interview is that Dr. Beck is diet agnostic. She keeps bringing up that a balanced diet is key. Now, I know for many of you, a balanced diet is only meat focused, and I support that. We have had patients in our practice that had osteopenia in their DEXA scans or their bone density scans. And as they had a lot of bone broth and ate a meat-based diet that were rich in fats and reduced their stress levels or their cortisol levels, they went from osteopenia to having normal bone health. I also didn't bring up too much the impact of stress on the body and bone health because I really wanted Dr. Beck to share all her expertise and experience with us. But when your body is stressed, your adrenals or your endocrine system will pull minerals so that it can use it to produce cortisol. And so if you have calcium and all of the other cofactors to support your bones, your body will leach it from the bones to support your hormones and your adrenals. So this is how, when you are stressed, and then your body needs to balance the major minerals, which is calcium, magnesium, potassium, and sodium, it will start stealing it or leaching it from your bone health. So all to say, diet is a huge factor in your bone health. But as you'll hear Dr. Beck say, there are many more things we can do to support our bone health other than the diet. The diet is absolutely a baseline, but make sure to watch the interview so you can learn more. Hi, Dr. Beck. I am very excited to have you join my channel. For the people that may not have heard of you, if you can introduce yourself.
So I'm Belinda Beck. I'm a professor of exercise science at Griffith University on the Gold Coast in Australia, and also owner and director of the Bone Clinic in Brisbane.
Okay, well, thank you so much for joining me today. I'm really excited to talk about all things bone health. When I was young, there were children or my peers that would break their arm or break their leg, and then they would get on casts, and then they were so cool with these different colored casts, and then people would write all over it with Sharpies. And I always wanted to break a bone so I could be part of that collective, and I never broke a bone. And then you mentioned something about genetics and bone health. If you can explain why certain people maybe are more susceptible to breaking bones, or does that mean that their bones are a little bit more brittle? I mean, what is it about bone health?
Well, there's two elements to your risk of fracture at any stage of your life. The first one is definitely genes. Genes predispose us to the size of our skeleton, the shape of it, and what makes it strong. The other thing, and the environment as well. I'm sure we'll talk about that later. So the combination of genes and environment. But the other thing is exposure. So lots of kids break bones when they're young, not because they have inherently weaker bones, but it's because they are putting themselves at risk. They're the kids who, like my daughter, would be jumping off the back of the couch. She broke 2 forearms before she was 4, and it's purely because she was so active, not anything to do really with the strength of her bones. So you see that in the numbers of regular fractures that young boys have, particularly ones who are playing sport. So yeah, it's two things. There are some people who are more susceptible because of their genes. Some people are more susceptible because they go skydiving.
And then when you say genetics, what does that mean? So is it just your bones are bigger, they're just stronger? What is it about the genetics that makes people's bone, I guess, healthier?
Again, more than one thing. Bone strength is a complex combination of characteristics. How much bone there is is probably the primary thing. And that's sort of what we're measuring when, if your doctor sends you for a bone density scan, that's kind of what we're trying to measure. It's not exactly bone mass because unless you can take a bone out of a person and actually measure the mass. It's impossible to measure mass per se. So when you're alive, we have a bone density scan because that picks up mineral, which is mainly calcium in bone. And the density of that gives us an idea of how much bone there is. So it's an estimate of bone mass. So that's one thing that your genes sort of predetermines how much mass you have. The other thing that is really important is the shape of bones. There are people who have the bone in our thigh is the femur. I'm not sure how many of your listeners know much about anatomy, but at the end of the femur that's closest to your body, we refer to as the hip, even though the hip itself is actually the joint. But the part of the femur that goes into the hip joint is called the femoral neck. And that neck can be different lengths. The longer the femoral neck is, the more susceptible it is to fracture. And it's one of the reasons why, even though Asian genetics tend to create a predisposition for lower bone mass, they have shorter femoral necks, so their risk of fracture might actually be lower anyway, just because of the bone structure. So, as I say, we get hung up a little bit on BMD because we measure that from DEXA. It's really hard to measure bone geometry unless you've got a lab like me where we do that. But mostly that's sort of an ignored element of bone strength, which is unfortunate because it's so important.
That's so interesting because my mom, so she eats a heavily meat-based diet now, and I saw some of her blood work from years before when she was diabetic, and they said that she had osteopenia. And it's interesting, but we then went to Costa Rica and she fell, and my husband was right next to her when she fell, and it was a pretty nasty fall. And we thought, oh no, she's going to break her hip and then never walk again. And then nothing ever happened. She just got up, kind of cleaned herself off, and she was fine. And I wonder if the diet has helped, which I assume she did because now she's not diabetic anymore. But I also wonder, like you mentioned, even if she's Asian, but the length of that bone, maybe it is smaller. And so it's impacting her it's just reducing the risk of her having a hip fracture. That's very fascinating.
That's right. And of course, that's just for your hip fractures. Unfortunately, we've got bones everywhere else that are also susceptible. So if you do have low bone mass, an Asian person is not protected by the structure of that. There's just as a risk of having crush fractures. And certainly we've all seen the photos of little old Asian people with severe kyphosis, which is the hump at the top of the back, and that's caused by osteoporotic fractures normally. Okay. So yeah.
Oh, that makes sense. My grandmother suffered from that. You mentioned that in adolescence, the mass and shape of bone health happens. Can you expand a little bit about what you mean by that?
Many people are not aware of the fact that we have the most bone we're ever going to have pretty much by the time you're age 20. A little bit longer for men because they continue growing a little bit more. And we call that peak bone mass. So during the growth period is where you grow most of your bone. And that's from that period between being a baby and being a toddler. That's a real fast bone development stage. But then the biggest one is going through puberty. And we've all seen it, that little boy that was our little darling hits puberty, gets a massive injection of testosterone and growth hormone, and up he shoots and turns into this croaky speaking, cranky, tall boy. and that's because his bones have been growing like crazy. Now, at that time, actually, there can be a window of increased risk of fracture because the bones grow first with an organic matrix. The bone cells produce this matrix of extra bone tissue that's called osteoid. Now, bone cells don't produce the calcium. They just produce the organic matrix. Calcium and other minerals then mineralize that new bone. So there's a little period there where growth is mainly in that sort of newer unmineralized bone. And so they may be at more risk of fracture if they're doing very high-risk sports. Mind you, I don't even like saying that out loud, and I probably shouldn't have, because I don't want parents to think that they should stop their kids doing exercise, because that is absolutely the single most important thing you can do during that growth spurt. Because We've all, as I said, have a genetic potential for a certain amount of bone, but the more you can optimize that, squeeze every last bit of potential you have in your genetic makeup to get the most growth you can when you can, and that is an absolute prime time.
So during that period, exercising and moving, does that support, and obviously nutrition and all of the building blocks to help support the body grow, but does exercise and movement support the growth of bones as well during that period?
Absolutely. There's plenty of data to show that. There've been some long-term cohort studies tracking kids from very much pre-puberty through puberty and later. And you can see the active kids are the ones who are gaining most bone.
Oh, wow.
For sure.
And then if you break a bone when you're young, there's some people that believe that once a child breaks a bone, maybe their bone health won't be as strong. Is that just a myth, or is there some truth to that?
Now, there's no cause and effect. So because you've broken a bone, it doesn't mean that your bones are going to be weaker. It's more the fact that you've broken a bone because your bones are weaker. That's one of the. But remember also, your bones might not be weak. You've just been abseiling and you've fallen off the rock face. It's exposure.
How long does it take, if you can walk us through bone remodeling, like how long it takes for a bone to grow, and then and what it takes to really have healthy bone mass?
Yeah, that's a really good question. And it definitely is going to be an individual thing. But in the main, we've known for many years from very clever histologists who track bone cells and their activity that the remodeling cycle begins with what I call osteoclasts. These are, if you think back in the day, you're probably too young, but in the 80s, there were Pac-Man, that video, the little Pac-Man that go and munch through things. That's what the osteoclasts are like. They munch through bone. And there's a reason why they do it. They're not just destructive for the sake of being destructive. They are normally just getting rid of damaged bone. So they're a construction crew. They're getting rid of that. Or your body needs calcium at a point in time and you haven't eaten any that day. So they go to the bone bank and they release some into the bloodstream from your skeleton. So the osteoclasts come along, they munch through some bone, and they open up a little tiny tunnel, and along come the osteoblasts, which are the bone builders after them, and they rebuild that packet of bone. So that one full remodeling cycle of resorption and formation takes, for that little, it's called an osteon, about 4 months. But then remember that new bone that the osteoblasts have extruded needs to be mineralized. And there's all manner of different time periods of how long that can take, and probably depends on diet and all sorts of things. But that's roughly 6 months for new osteoid to be fully mineralized. So it's the reason why if you're having your bones examined by DEXA, which is an X-ray machine and picks up mineral, you really need to wait a good 12 months. If you've done something to improve your bones, say you've gone on medication or you've started an exercise program, 12 months will really give you the best opportunity of seeing that difference, because otherwise, if you go too soon, you won't detect the mineral that has gone into that new bone.
The mineralization of that bone, or the soon to be bone, and I know you said it's individualized, but what does it take to remineralize that?
So number one, nutrition is not my field, so I don't do specific dietary interventions. We assess people's diet and we tell them how much they're eating of what and where they need to sort of improve. So I've never done anything where I've said, we're measuring you here, you need to improve that, come back in a year and then measure them again for that change. It's just been a more organic kind of a process. The short answer to the question is far and away, light years ahead of any other mineral, micronutrient, macro, anything, is calcium, vitamin D. The rest is all just playing around the outsides. And, there's people talking about vitamin K2, magnesium and zinc. And I mean, there are all of these other things. But in reality, the amounts that you need to contribute to bone health, I think, are amounts that you will get in your diet. If it's a balanced diet, and particularly things like green leafy vegetables, that's got most of the things in it that you need, except for calcium. Of course, dairy is your best source. But what I can say is that the interventions, the clinical trials that have looked at those nutrients have not been particularly good quality and have been less than conclusive. Normally the people who are supporting the use of supplements for, say, vitamin K2 are the supplement companies. Now, until there's better data out there, I am absolutely not willing to put hand on heart and say a supplement will help you. But what I'll say any day of the week is a balanced diet is what you need, and will give you virtually everything you need for your bones, as long as you're getting a little bit of sun and you're getting your 1,000 milligrams of calcium a day.
So let me flip the question then. So what have you seen in your patient population that causes them to have to remineralize their body or their bones, or the Pac-Mans come out and then have to do all that work? What is it that is causing the osteopenia or osteoporosis for them to even have to come and see you?
Again, fabulous question, and not easy to answer, because it will be different for everyone. There's a million reasons. If you think about the risk factors for osteoporosis, the first and foremost is genes. 80%, up to 80% of what your bones are going to be like when you're a little old lady is determined by your genes. So we're working with this sort of 20% of what I'm going to talk about next. The other is sex, and that is being female. And there are reasons for that, but I'll get sidetracked if I go off down there, but I can come back to that if you want. And then the other is age. And so the older you are, the lower your bone mass. The other is physical activity. Then you have things like whether you've been on high doses of glucocorticosteroids, which are terrible for bone, long chronic duration of steroid prednisone, it's really bad for your bones. If you've been on aromatase inhibitors with breast cancer, really bad for your bones. And we do see people with breast cancer survivors who now are coming to look after the bone that has been destroyed by the chemotherapy. And we certainly can help them. Alcohol, nicotine's bad. Rheumatoid arthritis is closely associated with risk of osteoporosis. And then there are some other drugs and other conditions that are not great. So there's a million things, a million combinations. But I would say your very best chance of avoiding osteoporosis towards the end of your life, irrespective of what your genes are predetermining your bones are going to be like, is to eat a balanced diet with plenty of calcium, vitamin D. More importantly, stay active, and stay as active at as high intensity as you can your whole life, because there's certainly evidence that masters athletes who do stay very active at a high intensity hold on to their bones across life, whereas the rest of us are losing bone. And so it may not be a case that osteoporosis is an aging disease. I personally think it's a sedentary disease.
And what is it about being sedentary that causes the bone to degrade? I mean, what is it about the athletes? Obviously, they're a lot more active, but what is it, about the movement per se, that causes the bone to be so strong?
Yeah, another good question. There's sort of the mechanism of adaptation to mechanical loading. It's really cool. This is why I love this tissue. It's just amazing tissue. And we've known for years that mechanical loading, physical loading is important, because we saw astronauts, in the very first missions losing calcium like crazy and losing bone. Unloading in reverse, makes you lose bone. We understand that when you load bone mechanically, it bends just a little bit. Now, bone has holes and channels all through it where the bone cells sit. And they sit in those little holes, and they reach out their little hands, if you like, and hold hands with each other. So there's actually a great big network of bone cells, which are called osteocytes. And they just all throughout the bone, you've got these little cells. When you load it and you bend the bone a little bit, the fluid that they're bathed in their little holes squeezes from one side of the bone to the other. And it's thought that fluid flow, that movement, actually stimulates those osteocytes to send out a message. Okay, this is bending too much. If you bend too much, it's going to break. So that triggers a message to build more bone to prevent that bending. So it is absolutely this beautiful physical signal in response to physical loading that sets up this molecular process of adaptation.
And then are there certain types of exercises that will do that even more, so that liquid to, support the body even more?
Yeah, exactly. And that's the whole crux of what we do. So we've been testing a program that is more likely to bend bones than the very low intensity exercises. And we know from years of exercise interventions, walking is not enough. The bone is, if I can anthropomorphize bone for a second, it's clever. It knows when that if you're walking, well, you do that every day. I'm not, I don't need to bend for that. I'm already adapted for walking. So it's not bending the bone at all. So it's not going to adapt to that. Doing more walking, it's not going to change anything. Swimming actually unloads the body because it's not even weight bearing. So I'm not saying swimming is bad. Please don't, I don't want anyone taking away that walking and swimming are bad. They're so good for you, but they're just not your bone exercise. Cycling, the same thing. It's unloading the bone because it's weight supported. Even though you've got this high amount of muscle activity, it's the weight bearing that seems to be key. And combined with the muscle activity, obviously, that has to overcome gravity. So small loads from things like Pilates, walking, ballroom dancing, all of those things, that is not building bone. Great for all sorts of things, not building bone. So you've got to do something that's heavy and has impact in it.
So I know lifting would then help, but what about just body weight, like body weight squats? Would that help, or would it even be more beneficial to have weight on my body weight squats?
Yeah, body weight squats are not even close to being enough. Because if you think about it, how many times you do a body weight squat, every time you sit down, you're doing a body weight squat. So your bones are just meh. I've seen that before. I don't need to adapt to that unless you are immobile. So, and some people, when they're sick, they can be bedridden or they can be confined to a chair. So they're not doing it very much. So body weight squats will be great for them because it is actually a stimulus. But if you're just a regular active person moving around, doing regular, walking up and down stairs and hanging clothes on a clothesline, which we still do in Australia, and those sorts of things, your body needs more than that to actually get that stimulus to make the cells go, okay, that I just bent, I don't want to bend, I need more bone to stop the bending.
Okay, so basically you have to challenge yourself by doing a little bit harder or more than you do in a typical day for your bones to go, oh, I'm getting the signal, and then let's strengthen the bone.
Yeah, and not just a little bit. We're talking about that. That's what I do. This is the whole reason that the clinic and my program exists. It has to be a considerable amount of load, and remembering that each person is different. That person who has been bedridden, it's going to be a very very small amount for them to increase the load on their skeleton than it would be for an Olympic lifter who's been lifting all their life. They would have to increase a huge amount because their bones will already have adapted to the lifting they're doing. So it's a initial values principle. The lower you are, the more easily you'll adapt. And diminishing returns principle, it's sort of the same concept. The higher you are, the less effect it will have.
There's always this struggle with people lifting, and then there are some people that say lift to basically failure, and then there's a concern that you might tear your muscles too much. What's the right balance, especially that you've seen in your clinic, where you are trying to bring that stressor without also impacting other parts of your body that might be in excess stress?
There's a couple of ways to answer that question, but I suppose the overarching answer is it's very rare for a person to be able to be physically lifting something willingly,
Okay.
Sufficiently that it's going to hurt them, because we've all got a natural aversion to doing things like, no one's going to just walk up to 100-kilo crate at the local garden store and want to pick that up. We don't tend to do that. the key is lifting very specific kinds of doing very specific kinds of lifts, and having somebody who is an expert teaching you how to do it and supervising you when you do it. Those are the people who can give you the exact prescription as to where you need to be. This is what we're going for. We want you to be doing this, but this is where we're going to start you, so we can teach you the movement at a very manageable level and just gradually bring you to where you need to be. And it's very rare that people can't get there safely, and because the body is such an incredible organism, it adapts to the loads that we put on it, not just our bones, but obviously our muscles, our tendons, our ligaments. All sorts of things are adapting to this, and you just get stronger and more able to do it. The worse condition you are when you start, the slower that progression is and the lower you start. But, we have extremely frail people who come to the clinic and, 6 months down the track, there they are lifting. They might not be Olympic lifting, might not be, through the roof, but they're lifting way more than they ever thought they could. And they're doing it without any risk at all, because they're being supervised by somebody who knows how to teach them technique.
Yeah, I can share a testament even of myself. So I always wanted to be more on the lean side than to build mass. And as I'm aging, my values and my priorities are shifting. So I am Asian. So I am, and my mom had osteopenia. So I am worried that I will have bone health issues. I've ran a DEXA recently and it looks okay, but there's areas I can improve. And so now I'm starting to do a lot more weight bearing exercises. And just recently, our family has been doing it every single day. And then within 3 months, now I could do a full push up and I could probably do about 10. And I'm trying to do more. And then I just, started at the gym, starting to lift even with more weight. So I can totally see that. And I can see the definition even in my body. So I totally agree with you. It totally can happen. The question I'm sure people are asking is, well, how much? And I know that how much will differ per person, but how often do we need to be doing these weight-bearing exercises to support our overall bone health? Hey guys, just a really quick interruption. If you notice, we don't really run ads on this YouTube channel. And just being fully candid, instead of making money on external sponsors, we really wanted to share more about our functional medicine practice, so that if you ever need it, you know that what we offer and what we can provide in terms of service and products. If you didn't know, our private practice has one-on-one sessions. We have packages. We do group calls with SIRS and with mind body or nervous system regulation. And we also do a lot of functional tests. Some people do a complete wellness panel with us. So once a year, they get a detailed, comprehensive blood work to see how their health is doing. We also do functional tests such as stool tests to see if you have parasites or candida or H. pylori. We also do a lot of the Dutch urine as well as saliva tests to make sure that your hormones and thyroid is functioning well. Our flagship is our symptom burden, where we really trust the innate wisdom in our bodies. And so we are trying to see what symptoms do you have, because oftentimes a combination of symptoms is related to a specific system. We focus on gut health, where we try to get people's gut healing, because most of our immune system is in our gut. If you make your own body stronger, you will be a lot more resilient to everything that is in our toxic world. We believe in wellness for all, and not everyone can afford to work with us. So we provide a lot of free guides, free ebooks, free downloads, free tactical things to get you healing in your wellness journey. We also write comprehensive, detailed articles. For example, why a carnivore diet may have lower T3 markers, but may be in fact okay. I hope that the content I share is enough for you to get healing. But if the needle is not moving enough with a carnivore diet, with lifestyle changes, with mind body work, if it's not moving enough when you are working alone, just know that we have the services to support you when and if that day comes. Because we are holistic health, we also have a prescriber. So if you are on thyroid medications or hormone medications, or you need medications for SIRS, we are able to walk you through the process. Our goal is to get you off most of your medications. All right, guys, thank you for being part of this community. Let's get back into the video.
And first of all, I just want to say that what you just said about getting stronger and doing push-ups, that makes me so happy. Okay. No matter how many times I hear stories like that. I just love it. It's the reason I do what I do. Yeah. So in terms of how often people need to exercise for bone, there is no definitive answer, but my recent research does suggest that probably 3 times a week is going to be the best,
Okay.
but I think twice a week is enough to get a really good response, and once a week is definitely better than nothing. I mean, something is always better than nothing, but if it's something of the right kind of exercise is better than nothing. So, yeah, I just, if people are worried that they haven't got enough time to take on, 3 days a week, don't worry. Just do it once a week. Just do something and get yourself started. And, doesn't mean that you'll ever actually graduate to doing more than one. That might be it for you, but you will still get benefit from that. And you might be able to increase in the future.
And I think the more you do it and you start feeling stronger, like I definitely feel stronger now and I see more definition and it just makes me want to do it more. So I just think that I think what you just got to get started. It's starting is half the battle, but you just said 3 is perfect. So then if I did 5 or 6 or even went 7, is there actually a detriment to bone health if I were lifting too much?
Okay, so yeah, most of these questions are there's not enough data
Okay.
to tell you definitively. And I should say, just not based on just our work, but a group in the UK did an interesting experiment that was a hopping experiment so that they could compare the hopping leg to the leg that wasn't landed on. And I think they showed the ideal amount of hopping. So an impact activity was 4 times a week. Now, not 7. So I think there was a bit of a plateau. My sense in terms of bone and muscle training is that there probably is a tipping point where doing too much is certainly not any more beneficial and potentially detrimental, because the stimulus is important, the training is important, but it takes a while for the physiology to adapt. So the muscles, they adapt in a different way from bones. Obviously, they're a different kind of tissue, but as soon as they're stimulated, the whole bunch of metabolic processes in the muscle will start off. If you hammer them again the next day, you do increase the risk of inflammation, which might be sort of catabolic rather than anabolic. So, yeah, I would definitely give yourself a rest between lift days to allow the tissues to adapt. I would certainly not be advocating for lifting heavy 7 days a week. I do think you need rest days.
Okay. Okay. No, that makes sense. And then in terms of measuring bone health, in our complete blood count, in our complete metabolic panel, we measure calcium, magnesium. But what I've seen with the data that we've seen through our patients, your calcium will be balanced as much as your immune system or your health can balance it, but it doesn't mean that you are not heading towards osteopenia, because I think of the blood as just a highway that your body is constantly trying to be in balance. So what is the best way then to measure your bone health, your calcium levels? Because I just think that a lot of people see, oh, look, my calcium looks good in my blood, so therefore I'm fine. But usually it's not until it's too late or already getting to illness that then your calcium starts showing imbalances in the blood.
Oh, I wouldn't use calcium in the blood as any kind of
Thank you.
indicator of osteoporosis. No way. And I love your analogy of blood just being the highway. It is. That's
Yeah.
just how things are interchanged and we get oxygen to our cells and that
Yes.
sort of thing. Yeah, absolutely. Calcium in your blood is absolutely not reflective of how strong your bones are. You do need to have a bone scan, so a
Okay.
bone density scan if you want to look at that. And that's, still with the caveat that BMD is not the be all and end all of bone strength, but it's what we're most familiar with. It's what doctors are best able to interpret when they get the results. And I think the data shows that 75% of your risk of fracture can be predicted from your
Okay.
your results. Now that does mean that there is error in that measure, and so it's not perfect by any means.
How often would you recommend doing that BMD test?
Well, we at the clinic we do it once a year
Okay.
because we're a research facility, and so I want to see what's going on in very in as real time as you can get from a bone scan. I'm not sure if it's the same in the US, but in Australia, Medicare will reimburse for a bone density scan once every 2 years. So that typically is when the GP or physician will order a bone scan just once every 2 years, but they're very inexpensive.
Right.
So if you want another one in the meantime, just go and get one. And they're low dose radiation, so it's nothing really to worry about there.
Okay.
In Australia, if you do have a change in therapy, like you go on a different drug, you can actually have one at 12 months. But I just think, tracking every year for if you're doing an exercise program for the purpose of increasing your bone mass is a good way to monitor if what you're doing is working. If it's not working, you don't want to wait 2 years to find out.
And then what age would you start having people test their bone health?
You've got some good answers, good questions, Judy.
I'm a curious person. I don't know.
So probably right before menopause would be my recommendation. And for men, round about, 55, 60, that sort of age, because they don't go through the same precipitous loss that women do because they don't go through menopause. Their loss is more gradual, starts a bit later. But yeah, I would get a benchmark. Where was I when I was premenopausal kind of scan? And then, every couple of years after that, probably keep track. There's all sorts of things that go on with you as an individual that your doctor will know about that will help him to determine how often he or she needs to be monitoring you, because of the things that I mentioned before. Is this person having 7 alcoholic drinks a night? And you might be surprised to know that there are some people who do that,
Right.
and that does terrible things to their bones. Did somebody go through early menopause? Is somebody chronic asthmatic, and so they're on high doses of a steroid puffer? So they might want to monitor them a little bit more closely.
That just makes me think of, so if a child is on asthmatic medications or the inhalers and they're using it a lot and throughout the day, could that actually cause their bone health to not?
Absolutely. Yep. At any stage of life, steroids are not great for your bones. So, and the doctor will be able to tell you this. They certainly should be warning you about this when they put your child onto this kind of medication, that this is something you need to be concerned with, or at least consider, that you need to titrate that dose down as low as possible, because steroids are extremely important for some people. I'm not saying you shouldn't take them, because breathing is, that's life-giving. You can survive a fracture. You need to be able to breathe. So just get the dose as low as possible. And that might need a little bit of titration and experiment, and probably go up if they're ill on any one occasion and then come back down again as quick as possible. But yeah, you definitely want to keep the steroid levels as low as possible.
Would you say that steroids are one of the biggest causes of bone density being reduced? I know you said there's a variety of reasons, but if you were to say top 2 or 3 culprits, is there, top 3 that you would say?
It's hard to answer that question because the number of people on them is low. So of people on them, absolutely.
Okay.
It is one of the absolute top reasons why their bones are low. If people who are on chronic high levels of steroids, absolutely, it is a reason. But because the vast majority of people are not, I can't say that it's the top reason in the per se. When you do, I don't know if you're familiar with FRAX. So it's a fracture risk calculator, and I believe steroids is one of the questions in the FRAX because of its relationship to fracture risk.
Okay.
So it's definitely something that you need to think about.
There was a patient of ours that so they were suffering from osteoporosis, and their doctor recommended them getting on a osteoporosis type medication, and they got a second opinion, and the second opinion was, no, you don't want to do that because it basically, you're robbing Paul to feed Phil or something like that. So it's like taking bones from one area maybe, and then it's like maybe pulling it from your jaw to feed the area that you are showing osteoporosis. What are your thoughts on those types of medications?
Okay, so I think they've misinterpreted the doctor's explanation there, because the doctor wouldn't have said that, because that's not true.
Okay.
You don't rob Peter to pay Paul with bone meds if you're taking a bone medication, it's in your system and it's going to work
Okay.
systemically.
Okay.
What they may have said is that, I mean, there are a number of different drugs on the market, and people have to, and doctors have to make a decision as to which one is best for the person. Some are more efficacious than others, but those may actually not necessarily the best choice when you're young, because if you react badly to them and you have to come off, you'll lose bone very rapidly. So that may have been what the message was from the doctor. I wouldn't put you on Prolia when you're age 50, because if you've still got 50 years of your life to live, or whatever, however long, and you are going to have to come off it at some stage, at which time you'll lose bone precipitously. So it's best not to go on that when you're young. Save that one for when you're older, when you can probably just stay on it for the rest of your life. Go on a different med that doesn't have that same withdrawal rebound effect. Yeah, so I suspect that's what they were talking about.
But do you recommend people trying these exercises and doing the lifestyle changes first before getting on meds, or are there people that just need to get on these types of medications?
Again, another it depends on the person question. Yeah, totally depends
Okay.
how severe their osteoporosis is. We have lots of people who come to the bone clinic and they have that exact question in mind.
Okay.
We have a look and see how bad their bones are. If they're osteopenic and they're relatively robust and they don't fall very much and their risk in other respects is quite low, we say, I think you're safe to give it a go. And they build bone, they get themselves into the normal zone and happy. There are others who might have a T-score of sort of -4. They're very high risk. They're very frail. If they sneeze, they might crack a rib. That person, I think, needs to consider medication, because they need a response immediately and they need to throw everything at it. So
Okay.
they need exercise as well. And this is the great thing about exercise, is good for everything. So it's no harmful if you do it as well. But they probably also need to consider meds to just give their bones the absolute best chance of growing.
Okay. In the US, there's a statistic where, especially women, after a certain age, maybe it was, I think it maybe past the age of 60, that if they have a hip fracture, maybe 50% after 5 years will not live past that. And I think of that percentage, I think it was only 33% that after they fall, they maybe never make it out of the hospital and they'll never walk again. And then many of them pass away. What is the reason for that? And how can we mitigate that we even have that hip fracture? And maybe just everything we've already talked about, but I just wanted to put that statistic, that scary statistic out there.
Yeah, I don't think it's as low as 60. When you look at
Okay.
I have a plot in my mind of mortality after a hip fracture, and it's actually quite low when you're 60, but when you're
Okay.
90, almost everybody dies within 6 months if you
Oh,
have a hip fracture when you're 90. And then it's sort of between those ages, it's
okay.
just going up, the risk of death within 6 months. The reason is almost certainly because of incapacity. So a hip fracture is a fracture where somebody who's quite old and incapacitated already is probably going to be bedridden, and all the bad things that happen when someone stops being mobile. The more risk of maybe they're in hospital of getting an infection,
Okay.
developing pneumonia. Something is going to kill them because of being incapacitated. That's the usual
Okay.
reason, or thromboses, those sorts of things. So the trick is to avoid it in the first place. And we talk about people being given warning about hip fractures. You've got to listen to the sentinel fracture. Quite often the first fracture is a broken wrist because somebody stumbles and falls on an outstretched hand and they break their wrist. Well, a broken wrist is, in the scheme of things, a bit of pain, very inconvenient, if it's your writing hand. But in 6 to 12 weeks, that's all healed and you're back to normal. What that is a big red flag. Your doctor, if they don't give you a bone density scan, they're virtually negligent, because that is a flag that your bones are. You shouldn't break your wrist from falling on a wrist. If you do, it's called a minimal trauma fracture, which is the definition of osteoporosis, irrespective of what your bone density is. So minimal trauma fracture is definitive of osteoporosis. So they should then send you for a BMD, and then they'll probably detect that you've got low or very low bone mass, and then start some treatment regime, which should include exercise, may include drugs, and between the two, they'll prevent that hip fracture. So that, and this is the biggest problem in the medical care of osteoporosis, is that it is not a very well recognized condition. Doctors are, the world over, are renowned for not recognizing it. Now, that's not from any failing of their own, except for the fact that the way the medical system is set up, with a 15-minute appointment and Mrs. Smith comes in with 100 different things, osteoporosis is very low on the list. So they oftentimes don't even get to it, so they don't get assessed, they don't get diagnosed. They're too busy dealing with the emphysema and the diabetes to even get to osteoporosis, because it's not thought of being so bad. But of course it is, and highly prevalent.
Okay. And then would you say that any bone fracture, any bone breakage would be the red flag too, not just the wrist?
Actually, there is some data to suggest that any fracture at all is a bit of a red flag, particularly in younger adulthood. But again, that's about, is somebody doing the high risk exercises? So you have to take that into consideration. But really, the ones that are the red flags are the low trauma fractures, the minimal trauma fracture. We're not talking about car accidents and skiing accidents here. We're talking about fracturing when you're falling, fracturing picking up a grandchild and fracturing a vertebrae, fracturing picking up groceries or in the garden. These are minimal trauma fractures, and that means the bone has not been strong enough to withstand what it should have been able to withstand. That's the flag.
Okay. Now that's really powerful. In closing, if you had 3 things to be able to support bone health, doesn't matter what age you are, what would be your top tips? I'm sure exercise is one, but what would be 2 others that you would recommend?
Yeah, so of course, exercise, and the right kind of exercise, is absolutely top of the list. I cannot emphasize enough how streets ahead of every other therapy that is. It's safe and ethical to prescribe at every period of life, because it's good for every other system. You can't prescribe a prophylactic medication, but you can exercise, and the right kind of exercise. The next thing is probably diet, because you need the building blocks, but not specifically suggesting that you should go and buy every supplement that has bone on the label. Just have a balanced diet. See a dietitian if you don't know what that is, and just make sure that you're getting a balanced recommended daily allowance of everything you need, and you should be right. Get a little bit of sun. Now, we are all quite averse to sun exposure if we're white-skinned or very pale-skinned. Particularly in Australia, we have the highest rate of skin cancer in the world, because we're white people living in a black people's country. The Indigenous Australians don't really get skin cancer, because they've got this beautiful black skin that doesn't get burned. 80% of Australians, that may be slightly out of date now, will get some form of skin cancer. So we are very aware, we're very averse to sun exposure. We wear hats, sun cream, long sleeves, particularly in the state that I live, which is very sunny. Unfortunately, the measures that have been taken on the Australian population have shown that this aversion to sun exposure has actually resulted in vitamin D insufficiency. And you need that vitamin D to absorb the calcium from your diet. So it's not just the vitamin D. Sun exposure on your skin is really good for a whole bunch of other things. So I say get a little bit of sun before the hottest hours of the day. Never come even close to being burnt. That would be, counterproductive. You should never even turn pink, but just get enough sun that you've got a little tiny bit of color. That will be giving that's the sign that you're getting enough
of the vitamin D. Yeah, one interesting thing we see, so our population eats a lot of heavy meat, and it's because whether they're on elimination diets or they suffer from diabetes, so they're trying to reduce that insulin from the carbohydrates that they're consuming. And as people remove seed oils from their system, so vegetable oils, soybean oil, canola oil, and all of those new oils that modern man has created, I guess it's more of an N equals many data point, but not anything proven in science just yet. but we have seen that people can tolerate the sun more. So I wonder if the sun is hitting our skin and it helps us to be able to absorb cholesterol and bring in the vitamin D. Our outer lining of every single cell uses cholesterol. And I wonder if we are using the cholesterol from animal fats, which is more natural than a lot of these vegetable oils that are, even the makeup of them are very different. But I just wonder if it's allowing our cells to absorb more of the vitamin D from the sun and not get sunburn. But a consistent theme we get in our practice is that as people reduce some of the seed oils or vegetable oils, they are able to tolerate the sun and be in the sun a little bit longer. So it's just a data point for you. I don't know what it means, but I mean, as more research ideally will come out, it'll be an interesting fact.
Yeah, it's that is very interesting. Be nice to see, some kind of controlled trial on that.
Yeah. Yes. It's always interesting, but thank you so much for your time. This has been fascinating. It really pushes me to want to lift heavier. I mean, my goal is to lift more and more. And yeah, thank you for all the work you do. Where can people find your clinic, the research you do, and the work you do? Where can people find you?
So in Australia, there's only one bone clinic, but you can Google that and you can find out what we do. It is a research clinic, but it is, it's where we help people with exercise and diet, and we collect a lot of data and we follow it up. So that's a good read if you just want to go and have a look at the bone clinic. Probably even more importantly is do a search for the word Onero, Onero. That's the name of the exercise program. And this is based on the research that we did at Griffith University. And that has been licensed. So all around the world, people are delivering it to their clients in their clinics. And you can be really confident that it's evidence-based and it's effective and it's safe if you've got the supervision of the people who've actually been trained by us. So there'll be, if you type in the word Onero, one of the things that comes up will be a map. And on that map, there are little red dots everywhere. If you click on those dots, that will tell you where that person is and who that person is.
Okay, that's amazing. Our practice will definitely look into that because we do have people suffering from osteopenia and osteoporosis. And yeah, it's so fascinating, all of this information about bone health. I will put all of your information in the show notes too, so if people can easily find it. But thank you again so much for your time and all the work you do. And I think it just furthers that we don't have to just be affected by our genetics. It is a big part, but there's stuff that we can do, such as heavy lifting, as you bring up, and you sold me on doing that more. So thank you so much again for your time.
No, my pleasure. Always like to talk about this stuff.
All right, guys, I hope you enjoyed this interview and understand that there is so much importance in movement and exercise beyond just building muscles, but just for your bone health. Why lifting and carrying heavy things really matter for your bone health and for bone density. Dr. Beck's program, the Onero Academy, really has evidence-based research that shows that you can really support and grow bone density through their program. If you are a physical therapist and want to support more of your patients to have stronger bones and bone health, you may want to look into her program. I will put all the information in the show notes, but just know that beyond diet, there are things that we can do to support our bone health. And one of the biggest things we could do is, one, get off medications or certain medications or limit them as much as possible, such as steroids. But two, to lift heavy things and push ourselves to do hard things, and at least 3 times a week. All right, guys, make sure to eat a lot of meat. Take care of your bodies and your bone health because it's the only place you have to live. I will talk to you later. Bye, guys.